Hi, my name is Dr. James Weiner, W-I-N-E-R. I'm director of the Weiner Wellness Center located at 2419 Baldwick Road, Pittsburgh, Pennsylvania, 15205. Our phone number is 412-922-WELL or 412-922-9355. Our website is drweiner.com, www.drwiner.com. We have two Facebook pages, one at Weiner Wellness Center, the other at James Weiner. We're also on Twitter at drjamesweiner. Today's talk is about three conditions that very often will be overlooked or missed by the medical doctors. You have to understand that medical doctors have a very limited knowledge base. It may come to a shock, as a shock to some of you, that they don't have a monopoly on the world's health knowledge. And basically their education is totally controlled and funded by drug companies, and so basically what they're doing is treating symptoms rather than getting to underlying causes. Now, I gave a talk on this subject about 4 or 5 years ago to a group of Amish practitioners and medical doctors in Shipshewana, the state of Indiana, because I felt these are these conditions are very prevalent, but very often overlooked or ignored or not even recognized by medical doctors. We're going to start with underactive thyroid. Now, what's happened in medicine in the last 50 years is there's more and more of a reliance on technology and testing. But this is a two-edged sword. Many of you have probably experienced that you go to a medical doctor and you have symptoms and you get a bunch of tests and then they say the tests are normal, there's nothing wrong with you. Anyone have that happen to them? Okay. What that means is they're missing what's wrong with you. Now, I have to believe, having been in this field for 45 years and being 68 and a half years old, that most people have better things to do than go to doctors. So I really think very few people are making it up. But very often they will insult you as a defensive gesture because they don't have the answers, so then they want to blame you, villainize the victim, and they'll tell you that you need to go to a psychiatrist. You need some psychological medication because there's nothing wrong with you. Now, we have a book in the store here about a woman who fell right into that category. She was having symptoms. The doctor said, there's nothing wrong with you. Then the next time she went, he said, I think it's your relationship with your husband. She had said nothing ill about her husband. She said, my husband and I get along fine. Next visit, it must be your relationship with your children. She said, my children and I get along fine. The next visit, the husband came with her and he said, look, buddy, there's nothing wrong with our family. There's something wrong with her. I've been married to her for 17 years. She never had these problems before. She's not making up, and you better start finding out what's wrong with her. So they ran more tests and found out she had cancer throughout her whole body. So this is someone that they were saying it was all in her head and it was a psychological problem or a social problem with her family, when in fact it had nothing to do with that. She had a physical problem. So I imagine those of you that raised your hands, you probably had a physical problem and you were just going to low information doctors that didn't have the answers and that treat you in a very arrogant, patronizing, condescending fashion, like you're an idiot, and so your input is not very important and not reliable and not to be trusted. My attitude is the more I listen to the patient, the more I'll understand what's wrong with them, and I don't think they're making it up. I would say in all the years that I've been in this field, maybe 2 or 3 people were making it up and they had an ulterior motive because they wanted to get on SSI disability or something like that. Virtually no one. I mean, that might happen once every 15 years. I run into someone who's making something up. So the overwhelming majority of people, 99.99% of the people that come in with health problems really have the health problems. They're not nuts. They're not making it up. They really have a problem. Now, I often say if it looks like a duck and quacks like a duck and walks like a duck, it's probably not a hippopotamus. So let's say you go to the doctor and you're tired and you have cold hands or feet, and your hair is falling out. Maybe you gain weight just looking at food. You've tried exercise, you've tried dieting, you're having trouble losing weight. Maybe your cholesterol is elevated. Maybe you have dry skin or weak nails. Maybe you're having trouble concentrating and remembering things. And then they run a thyroid test, and they say the thyroid tested normal, so you're making it all up. No, if it looks like a duck and quacks like a duck and walks like a duck, it's probably not a hippopotamus. If you have 3 or 4 or 5 of those symptoms that I just enumerated, you probably have an underactive thyroid. Now, wait a minute, what's this dichotomy, this seeming paradox between having a normal thyroid panel and having symptoms of underactive thyroid? The answer is simple, the test is wrong. I don't treat lab tests, I treat human beings. Now, I first learned about this concept about 40 years ago from Dr. Broda Barnes. He was a medical doctor that wrote 3 books on this subject, B-A-R-N-E-S. This concept was also elaborated in more recent books by Dr. David Brownstein and Dr. Mark Starr, that you can have a so-called normal thyroid blood test and yet have an underactive thyroid. Now, let's talk about, let's say you did have an abnormal blood test that showed that you had an underactive thyroid, like a TSH, thyroid stimulating hormone, that was maybe 15, 20, 50, 75 instead of being around 4. Normal range is about 0.4 to about 4.5. So let's say you're one of the lucky ones that has an underactive thyroid and has an underactive thyroid test result. What is the doctor going to do? The doctor is going to prescribe hormone replacement therapy, because their concept, their bias is that the body's not able to heal itself. They think once you have an underactive thyroid, you're never going to be able to get that thyroid to work better and make enough thyroid hormone for you. And so what are they going to do? They're going to prescribe externally produced thyroid hormone. And in recent years, they're relying on what's called Synthroid or levothyroxine. Now, there's 2 problems with this. First of all, I pointed out that maybe your body can actually make its own hormones. And number 2, levothyroxine or Synthroid is not bioidentical. It is not the same as what your thyroid will produce. It is exclusively T4. Now, I was on an airplane a couple years ago. This is very interesting. I got into a conversation with the guy sitting next to me. This is maybe 10 minutes before we landed. And ends up, he's a medical doctor. Not only is he a medical doctor, but he's an endocrinologist, which means he would specialize in thyroid. That's one of the endocrine glands. An endocrine gland is a gland that secretes hormones directly in your bloodstream, as opposed to an exocrine gland that secretes substances elsewhere, like your salivary glands secrete saliva into your mouth. They don't secrete hormones into your bloodstream. So you have 2 types of glands. The pancreas actually has 2 different functions, exocrine and endocrine, but the other glands are one or the other. So anyhow, he's an endocrinologist, and that would mean he would specialize in the pituitary and the adrenal and the thyroid, etc. So I told him, looking at him, I saw he had a full head of hair. So I thought, this will not be personally threatening to him. Then I have a full head of hair, and he has a full head of hair. Hey, we had something in common. I said, you know, I've had patients that were losing their hair and were bald, and they grew their hair back because I found they had an underactive thyroid. And he said to me, what does the thyroid have to do with hair? I didn't know there was a relationship. Now, I just rattled off all these symptoms. The one I omitted was constipation. Some people might have constipation if they have an underactive thyroid, but they may have hair loss, dry skin, weak nails, weight gain, trouble concentrating, cold hands or feet, et cetera, et cetera. So I explained that the thyroid has a lot to do with the hair, and if you don't have enough thyroid hormone, you might lose your hair. It's one of the symptoms. I said, now, if you have a patient that has underactive thyroid, what do? He says, oh, I prescribe Synthroid, levothyroxine. I said, well, you know that's exclusively T4. I said, do you know what the 4 stands for? He said, no. I said, it stands for, I back up. I told him that I give the patients iodine and they grow their hair back. And then he said, what's iodine got to do with the thyroid? Then I said to him about the T4, and I said, you know what the 4 stands for? And he said, no. I said, it stands for 4 atoms of iodine. He said, I didn't know that. Now, this is an endocrinologist, a specialist. And he didn't even know that. I said, now the trouble is with the levothyroxine is that most people have trouble converting T4 to T3 if they have an underactive thyroid, and therefore they don't really get much benefit from levothyroxine or Synthroid because you have to convert T4 to T3, where it now only has 3 atoms of iodine, in order to have the active form of the thyroid hormone. So he didn't even know that the T4 and 3 stood for iodine. He didn't know there was a relationship between the thyroid and hair loss. And this is a specialist. Now, my premise is, why not try to get your thyroid to make its own hormones? Now, some doctors are going to say, wait a minute, I'll prescribe Armour thyroid that's natural because it comes from a pig. I don't think it's any more natural to take pig hormone than it is to have sex with them. That was a joke. The thing is, we're not pigs, so why should we be taking their hormones? That would be a court of last resort if you had your thyroid totally removed and then we don't have a thyroid to make the thyroid hormone. Then you might have to have Armour thyroid, which would be a more acceptable form of thyroid replacement, as is Cytomel, Cytomel, than the levothyroxine or Synthroid. But if you have a thyroid gland, then what we ought to do is try to get it to work better. That's what natural healing is all about, getting your body to work better. So we recommend the Iodine Plus. Now, what is Iodine Plus? I had a cancer patient the other day. They said, well, in the Gerson therapy, they use Lugol solution. Lugol solution was invented by a chemist in 1830 in France. That was almost 200 years ago. It was good stuff, but we improved upon it. We made the Iodine Plus, which is Lugol solution plus selenium and tyrosine, a mineral and an amino acid that help the thyroid function better. So the Iodine Plus is an improvement over iodoral or Lugol solution because it has 4 ingredients instead of 2. And we've had phenomenal results. We have pictures over there. I should have brought it over here. A guy that was totally bald and grew his hair back going on our Iodine Plus. So some people that have severe alopecia or hair loss may have underactive thyroid. So the thing is that most doctors are going to miss this diagnosis because maybe they don't even know the symptoms, or they deny your symptoms because the blood work comes out quote-unquote normal, and they'll just ignore your reality and say, well, the blood work's normal, so you don't have underactive thyroid. But according to Dr. Barnes and Dr. Starr and Dr. Brownstein, many, many people have an underactive thyroid and yet have a quote-unquote normal thyroid test. Okay. Now, we mentioned that you might have constipation from underactive thyroid, as well as tiredness and weight gain and all this other stuff. Now, we have to talk about the intestines, because another condition that medical doctors basically don't understand is a fungal problem in your intestines. The normal, healthy adult human being should have about 5 to 7 pounds of good bacteria in the intestinal tract. Now, what happened was in France in around 1860, there was a guy named Louis Pasteur, and he postulated that infections were caused by bacteria. There were other scientists at that time, including Béchamp and Virchow, who said, no, bacteria is ever present in the environment, but if someone's body has a strong enough immune system, they can fight it off. And that explains why some people get sick all the time and other people don't get sick, and they may live in the same household. I virtually never get any kind of cold or flu because I'm eating a healthy diet which optimizes my body's potential to fight off these ever-present bacteria and viruses. And actually, it's reported on his deathbed that Pasteur said, you know what, Virchow and Béchamp are right. Really, the environment is more important, the inner environment of the person, their immune system. Now, what happens is that medical doctors are still stuck in the 60s. I'm not talking about bell bottoms and long hair. I'm talking about the 1860s with Louis Pasteur, where they think that regardless of what you present with, you need antibiotics. And so antibiotics are prescribed for almost everything. Antibiotics and also prednisone and cortisone steroids. And if you don't go to medical doctors, you're still probably getting a lot of antibiotics if you're consuming beef, chicken, fish, or dairy products. How many people here either eat beef, chicken, fish, or dairy products? Let's see a show of hands. Almost everyone here. If you're eating commercial beef, chicken, fish, or dairy products, you are getting antibiotics because they're giving it to the animals. Now, why do they give it to the animals? Because the animals are raised in a very sick condition. And they're fed the wrong foods. For example, how many people think that corn-fed beef is a good thing? Let's see. It's a bad thing because cows were not designed to eat corn. So they're trying to make an asset out of a liability. They'll brag that it's corn-fed beef, and that's why these animals are so sick, and very often there's these huge recalls of steak and hamburger, etc., millions of pounds, because there's so much bacteria growing in the intestines of the cows because they're eating a food they can't digest. And so it rots and creates all kinds of bacteria. And of course now, virtually all the corn in the United States is genetically modified, which is even worse. There's a wonderful movie on YouTube, youtube.com, called Genetic Roulette. If you've accessed the internet, you should watch this movie, Genetic Roulette. And it explains that the genetically modified food was intended to destroy the intestines of insects. But when you or your children eat it, guess what? It's destroying your intestines or their intestines. So we find a lot of people now have what's called celiac sprue, which is an allergy to wheat and gluten. The wheat today is not the wheat of 20 years ago. We have an excellent book called Wheat Belly by Dr. William Davis. We have it on sale here today, 20% off, Wheat Belly. And he's explaining the wheat that you're eating today is not genetically the same as 20, 25 years ago. Wheat used to grow this high, something like 4 foot high. Now it's like 2 foot high. It's a totally different plant. And it has different characteristics and it's affecting people adversely. So anyhow, they're putting antibiotics in everything. And what happens is antibiotics kill off bad bacteria, but they also kill off good bacteria. Do you remember a couple minutes ago I said we're supposed to have 5 to 7 pounds of good bacteria? So what happens is the antibiotics indiscriminately kill off the good bacteria in your intestinal tract, and then you get what the doctors are calling C. diff. Anyone here C. diff? Show of hands. C. diff. Now let's explain C. diff. This is an abbreviation for Clostridium Difficile. Any of you study Latin or French, you'll know the word difficile means difficult. What is difficult about C. diff? What happens is when you take antibiotics, It will kill off a lot of the bad bacteria in your body, 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 in your body. Take antibiotics, you kill off all the good bacteria, and the only thing left is this commensal known as Clostridium Difficile, and then they wrongly say that's why you have diarrhea, gas, bloating, constipation. It's the C. diff. No, you always had the C. diff. What you now have is a fungal infection. So we've given you this Candida Solutions from Nutritional Frontiers. Candida is a word for fungus. In fact, Dr. Tullio Simoncini in Italy found there's a connection between fungus and cancer. In here we have some suggestions. Now, what I've done with Nutritional Frontiers is I've tried to make it user-friendly. Most of our products are powders, capsules, chewables, liquids. We're trying to make it easy to assimilate, easy to take. And what I've also done is I used to, when people would come in and they had psoriasis, which is invariably a fungal infection in the intestinal tract, or they had these other symptoms like mouth thrush where they got like a brown or black tongue. You know, maybe they had a history of taking prednisone, cortisone, or antibiotics, or maybe they're just eating foods loaded up with those items. We would put them on an anti-candida program, and it was 5 different bottles. What I have done is put all those ingredients in one bottle. So it makes it easier to take and a lot cheaper. So it's very user-friendly. We call this product Candy Kill. We recommend you take 3 twice a day with food. Now the one thing is it does have oil of oregano, and oil of oregano tends to kill off some good bacteria. So what do? We recommend that you take either our Superbiotic or a Frontier Biotic between meals, a couple hours apart from the Candy Kill. So you're going to replace all the good bacteria that's been killed off by the steroids, antibiotics, or whatever. And also, birth control pills can cause a fungal infection in the intestinal tract and elsewhere. And yes, men do get fungal infections in the intestinal tract. So I tell you, if you go to most medical doctors, they're going to say they never heard of this. You now know more than they know about these subjects. So we have the Candy Kill and the Superbiotic or Frontier Biotic. We also have a thing called SBC, which is a prebiotic. And we have a number of different products we listed here. But those would be some of the essentials. And also dietary changes, because unfortunately, sugars feed Candida yeast. And so you have to get off not only refined sugar, candy, cake, pie, ice cream, soda pop, etc., but also fruits and vegetables and, well, not vegetables, but fruits and fruit juices. So we recommend staying away from fruit and fruit juices, and maybe some vegetable juice like carrot juice that's high in sugar. If you eat some carrots, I think that's okay, but carrot juice maybe avoid for at least a few weeks. So we'd recommend you get off fruit and fruit juice and don't use high sugar vegetables, and stay away from refined carbohydrates. And there are dozens of symptoms of Candida. You might have a foggy, spaced out feeling. You might have diarrhea or constipation or gas or bloating. Or maybe you get mood swings or depression. Or as I mentioned, skin problems like psoriasis. So there's a lot of different symptoms. And if you go to a medical doctor, they're going to give you drugs for those symptoms that will do nothing to correct the cause of the problem. So if you have psoriasis, they're going to give you coal tar dyes or steroids for your skin. They're not understanding that this skin problem comes from a fungal infection in the intestines. If you have depression or mood swings or you're spaced out, they're probably going to put you on anti-anxiety drugs or antidepressants, not realizing that you have a yeast problem causing this problem. And then, of course, you're going to have new problems. You're going to have side effects from those drugs. Okay, now a third problem that I have found that many people have, and medical doctors will almost never pick up on, is parasites. Now, when I was in school, we had an entire course on parasites, 4 hours a week for a whole semester. And what we learned was all these different names of worms and different infestations, but it was emphasized that this is basically a problem of the third world and tropical countries, not prevalent in the United States. Now, where do you think most of your food comes from in the grocery store? It's coming from third world and tropical countries. There was a front page article in the New York Times a few years ago above the centerfold where they were talking about there's this new epidemic of parasites because of people getting this food from third world countries where the parasites have their eggs inside the food and then you eat the food. And it can come from chicken. It can come from produce like fruits and vegetables. So this is very common. How about fish? Anyone here eat sushi, raw fish? Bad idea. Now, in Japan, when they have sushi, they have a thing called wasabi. If you go to a sushi bar here in the United States, they'll say that green paste is wasabi, but it's not, because wasabi is very expensive. So they actually make it out of horseradish and green dye. It's not really wasabi. Well, wasabi will kill off parasites. So someone figured this out in Japan, but here in the United States, you're eating the raw fish that has the eggs that have not been killed off by cooking. Or if you eat undercooked chicken or you're eating fresh produce, you may get worms. This is very common. Let me tell you a few symptoms. Swollen ankles. Let's say you go to a doctor, you have swollen ankles. They're going to immediately say congestive heart failure. Well, that's one reason why you might have swollen ankles, that the blood is backing up into your legs because your heart is not pumping right. But there's another reason. You could have lymphatic blockage in the intestines because of the worms, and that backs up the lymph system into your legs. Now, a lot of people know what edema is, like someone might have breast surgery and then they get a swollen arm. That's what we're talking about. It's that same type of thing, lymphatic backup. In the case of surgery, there's been a blockage created because of damage to surgery. But intestines can be blocked too by these parasites. How about weight loss? I've had people come in unexplained weight loss. You might think cancer right away, but they've been tested, they don't have cancer. How about low red blood cell count? Someone asked me today about someone had low blood cell count, and I said, well, the red blood cells can be low if you have parasites that are sucking out the blood. Now, if you go to a conventional medical doctor and they find out you have low red blood cell, they're going to put you on iron, but that's not going to help if you have parasites sucking out your blood. They may put you on a diuretic if you have swollen ankles, but that's really not going to help you if you have parasites clogging up your lymph drainage. You have weight loss, well, you could be eating all kinds of high-calorie food. You're just feeding your whole family inside your intestines that you're not aware is there. So just like animals get worms, human beings get worms. Once again, what I've done is I put together a combination product, so you really only need to take one product. Paracleanse. You'll see we have black walnut, wormwood, grapefruit seed extract that also helps kill Candida. Olive leaf extract kills all kinds of bad things. Palo d'Arco, cumin, garlic. So we recommend at least 3 twice a day for people that suspect they have parasites on an empty stomach between meals. We do not want to take it with food because that will dilute down the effectiveness of these poisons that will kill off the parasites. So you take it on an empty stomach. An empty stomach means take at least 2 hours after you've eaten or at least an hour before you eat. So between meals, empty stomach, 3 twice a day with water. If you can fit in 3 times a day, so much the better, but that might be hard. You know, because the rule is it has to be at least 2 hours after a meal and at least half an hour before a meal. So a lot of people that have irritable bowel syndrome, colitis, Crohn's disease may have either a Candida problem or a worm problem. And I find very often, let's say a teenager's put on antibiotics for acne, and then suddenly they start getting digestive issues and bowel issues. It's probably Candida created from the prednisone, cortisone, or antibiotics. People that may have been in the hospital for pneumonia, same thing. People that are loaded up with prednisone, cortisone, maybe they have asthma or they have rheumatoid arthritis. All of these types of situations will end up creating fungal infections if you're taking those types of drugs. And they give you prednisone and cortisone for almost anything. People with bad headaches are given prednisone and cortisone. Their irritable bowel syndrome, which may have been caused by prednisone and cortisone antibiotics, they give them more prednisone and cortisone. Rheumatoid arthritis, asthma, etc. So, I would say one of the core products that we have that most people would benefit from is the superbiotic, because you need to replace that good bacteria every day. And if you're eating the chicken, the fish, the pork, the beef, the dairy products that almost all of you raised your hands, you are getting antibiotics and maybe even prednisone and cortisone. You need to replace that good bacteria every day with superbiotic. Now, if someone goes in the hospital and they end up developing so-called C. diff, get them on the superbiotic. If nothing else, sneak it into the hospital. My aunt was in the hospital for 15 months. She had over a dozen roommates die from so-called C. diff. And the hospital staff couldn't figure out why my aunt never got the C. diff. Well, it wasn't really C. diff, as I mentioned. It was fungal infections. Because I was giving her probiotics every night. I was going there every night and giving her probiotics. They didn't know that. That's why she never got these serious problems that are killing thousands of people in hospitals every year. So anyone that's on any kind of antibiotics, prednisone or cortisone, must be taking at least the frontier biotic, and I recommend the stronger version, the superbiotic. So these are a few suggestions. And of course, there's mental and emotional problems that can be created by all of these things because the body is interconnected. You go to a specialist, and if you go to a GI specialist, first of all, they probably don't know any of this information, and second of all, if you have psychological problems that are caused by the problems in your intestines, they're not going to relate it, and they'll send you a psychologist or a psychiatrist. They're all looking at their little specialty, and they don't realize the whole body's interconnected. All right, so we have some time for questions. You don't have to limit yourself to Candida problems or thyroid problems or paraclens and parasites. I failed to mention about overactive thyroid. Some people do have an overactive thyroid, and usually we can correct that by detoxifying the person, especially of toxic metals. So if someone has an overactive thyroid, sometimes known as Graves' disease, that can be corrected in many cases by detoxification, especially metals. Yes, sir?
I just had a blood test and it came back as TSH, came back low.
What was low? The TSH, the thyroid stimulating hormone, was low. It was below, let's say, 0.4 or 0.1. Well, they might assume that you have an overactive thyroid. Yeah, well, it's inverse proportion. Let me explain that. The thyroid stimulating hormone in your brain stimulates the thyroid. So if the thyroid's not working fast enough, it's kind of like the boss says, you got to work faster, so you're going to have a higher TSH. If you have a low TSH, it may mean that your thyroid's overactive. So it's an inverse relationship. The thyroid stimulating hormone is high when thyroid function's low, and it's low when thyroid function is high. But we'd have to see if you're losing weight, that would be one symptom, or if you're real hyper, or if you have bulging eyeballs, which I don't see you having. The reason you get bulging eyeballs is because you build up a fat pad behind your eyes and it pushes out, kind of like bug eyes. You see the whites of the eyes. You don't seem to have any of the what we call facies, which is physical attributes of a overactive thyroid. So I'd want to investigate that more. We can talk after the talk. I probably would recommend some sort of metal detox to clear out the toxic metals, which we're all exposed to incidentally. Other questions? Yes, sir.
I want to tell everybody about 10 years ago, I heard you on the radio. And
Wait, can you repeat that? You heard me on the radio 10 years ago.
yeah, turned the radio on, I heard you, and you was talking about psoriasis, and I had severe psoriasis. I was in hospitals with it, and so I had an appointment with a dermatologist that week. So I told him, I said, he told me he wanted me to go on Remicade. And I said, Doc, I looked at the side effects of Remicade. I will not go on that stuff. I want to enjoy my retirement. I don't want to die of cancer or whatever, you know, the other side effects.
Yeah, because Remicade suppresses your immune system, because they have this crazy notion that so many of these diseases that they don't understand are so-called autoimmune, where your immune system's overactive, so they have to destroy it, rather than figuring out why, if at all, your immune system's active. It may be something that the body needs to fight off.
So I told him, I says, I heard this guy on radio, Dr. Weiner, and he said that he can help psoriasis, and he said, no, he says, he's a quack. He said, Dr. Weiner's a quack, and so I decided, well, instead of going on a Remicade where they give you injections, you give yourself injections in your stomach every so often, and you're slowing down your blood cells. So you right away, you know that's dangerous.
Let me ask you a question. The way I remember the story is that it wasn't that he knew about me. He just thought that anyone who said that they could cure psoriasis was a quack,
Yeah.
and that you would get worse if you went off the drugs he had you on, and that you would be back. Is that more or less true?
Oh, yeah.
And he also wanted to know what school I went to, if I remember. I seem to remember he said that he went to Harvard.
Pitt
And then
Harvard.
went, yeah, Pitt and then Harvard. Well, I went to Brandeis University, which at that time was twice as hard to get into as Harvard. And I may have shown you my college book on the American universities and colleges, where it showed that at Harvard they took 1 out of 4 applicants, but at Brandeis University they took 1 out of 7. So it was almost twice as hard to get into. Okay, and the SAT scores and everything were much higher at Brandeis. But that really had nothing to do with me learning how to cure psoriasis, because I didn't learn that at Brandeis. But anyhow, so you came to me.
Yeah, I walked in your office there on East Carson Street, and I seen your office there, and I was 250 pounds at the time, and pretty well 50% covered with psoriasis. And I made an appointment with you, and so I decided, well, I'm going to come down. I bought the supplements, Caprilix and stuff like that, and
Before you saw the doctor.
before I even seen you. So
Oh, okay, so somehow I recommended what you ought to
On the
take
radio, yeah.
on the radio, and so you got the recommended supplements and the diet and everything.
So I took them, and I seen you about 8 weeks later, and I was about 50% clear already before I even seen you.
Just following what I'd recommended on the radio.
Yeah, in due time, I was 100% clear, and I went to see the dermatologist about a year later, and he says, boy, he says, what happened to you? I says, I went to see this Dr. Weiner, you said he was a quack. And he says, he put me on to get the yeast out of my system, and he says, oh, he says, we studied yeast in school. He says, that yeast has nothing to do with psoriasis or fungus. And
So what explanation did he have that you had gotten cured following my protocol?
he couldn't understand it, and he didn't want to hear any more about getting rid of the yeast. He just didn't want to hear about it.
Yeah.
So cortisone, I replaced cortisone and light treatments with Candida treatments, and the rest is history.
Yeah, so let's give him an applause, because, you know, it takes courage to go against a medical doctor that brags about having gone to Harvard University. You know what I mean? I'll tell you something else about Harvard. When some of my friends went to Harvard, I didn't apply to Harvard, because the freshman and sophomore year, almost all the classes were taught by graduate students. And at Brandeis, they did not have any classes taught by graduate students. It was all professors. So actually, the education was much better at Brandeis, and probably most of you have never even heard of it. It was named for Justice Louis Brandeis, who was a Supreme Court justice. Anyhow, so the thing is probably the most important thing that I get out of what this gentleman just said is, he goes back to the doctor, proves to the doctor that he got rid of this so-called incurable disease, that I would be a quack for saying that it's curable, and the doctor did not want to learn what he did to get better. Okay? Now, if someone comes in here, and this is how I've learned a lot of stuff over the years, in the 45 years I've been in this field, people will come in and they'll tell me something I don't know. I say, wait a minute, let me write this down. I want to write this down. I want to research this. Gee, this is interesting. And that's how I've learned a certain amount of what I know is from patients telling me how they got well doing something that I didn't know about it, and I want to learn it because the next person that walks in, I'll now have another tool in my box to help them. But this doctor didn't want to know, wants his head in the sand, even though he's faced with the proof that this gentleman had this. And you had this for, what, 30-some years? How long did you have the psoriasis?
40 years.
He had 40 years of psoriasis and comes to me in a matter of months, it's all gone. Okay? Now, the most disturbing thing is not that this doctor didn't know how to help him, is that once he's confronted with someone who's helped, he still doesn't want to know. Other questions? Yes, Myrna.
Will you please explain, compare and contrast prebiotics and probiotics?
Prebiotics and probiotics.
And are they both in superbiotic, the product?
Okay,
And one
yeah.
more thing.
Mhm.
You're talking about yeast being intestinal. If I'm correct, and I may not be, yeast is also systemic. So would you explain systemic yeast?
Okay. Well, the thing is yeast is a type of mold, and it can grow anywhere where it's warm, wet, and dark. Now, some people have told me their psoriasis improves when they're in the sunlight. Why would that be? And why did they use the ultraviolet treatments that he was getting? Because it kills off the yeast that's in the skin. That's the answer. So a lot of people, they sit in the sun in the summertime and their psoriasis gets a lot better, and then fall comes around, they're not sitting in the sun anymore, it comes back. Well, of course, it was a systemic yeast thing, but what Myrna's talking about, inside the intestines, we would call that systemic. So you can have localized yeast like a vaginal infection or a fingernail infection of yeast, fungal infection in the toenails and fingernails, or it can be systemic. And of course, then it can spread to other organs as well, because the inside of the body is a very friendly environment for fungus because it's warm, dark, and wet. Now, what's the difference between the prebiotic and probiotic? A prebiotic is something that feeds the probiotic. So SBC is the most commonly prescribed over-the-counter item in Europe, because the doctors in Europe realize that if they put people on antibiotics or prednisone or cortisone, they definitely need prebiotics and probiotics. So the Saccharomyces boulardii complex, SBC, is a prebiotic that helps feed the probiotic. And yes, in most of our products we have both pre and probiotics, but some of them emphasize more one than the other. So it wouldn't hurt to take SBC plus Frontier Biotic or SBC plus Superbiotic. Other questions? Did you have a question?
I've heard this from a lot of people, but the sinuses, I know that, there's a lot of allergies out there, but a chronic sinus condition where you have the pain.
Chronic sinus and pain in the head.
Yeah, and then the postnasal.
Well, there's a lot of different reasons for that. First of all, we would recommend that people get off cow dairy products, cow milk, cheese, ice cream, pizza, because we find that the dairy is very adulterated now. We have a whole article in that spindle by where the food is, that metal spinning rack. There's a whole article on milk products. And milk products, incidentally, as I mentioned yesterday, actually cause bone loss. So you've been propagandized with a lot of disinformation. To build bones, you want to stay away from dairy products because they're too high in phosphorus. But in addition to that, a lot of people might have sinus because they have environmental allergies, and we have a method of correcting environmental allergies here that does not involve shots, drops, needles, or even products. In the interim, we do have products like our Allergy and our N-acetylcysteine and our Airmax that can help with sinus. And if you have a lot of mucus, we have the fenugreek. So we do have products that can help manage this, and then we have treatments that can help correct the cause of it. I also find that a lot of people have problems with detergents, fabric softeners, and anti-cling sheets. How many people here are using commercial detergents to wash their pillowcases? Let's see a show of hands. How many people are using fabric softeners or anti-cling sheets? These can cause irritation of the nasal passages of the mouth and the nose and the eyes. Sometimes people get itchy eyes or red eyes or whatever, itchy skin, sinus problems, mouth problems. You need to get on natural detergent, and we researched it, and we have the BioPack, which is the single purest thing that I've come across. That's all I wash my clothes in. So that's something, if you went to a doctor, they would never know. Let me tell you this story. I had an elderly lady come. She had a shoulder problem, but her main problem was she had this cough. And she couldn't understand why she had the cough. So she goes to the medical doctor, and he says, "It's your heart. I'm going to put you on heart pills." And she said, "Well, I don't think I have a heart problem." I asked her, "Do you have trouble running up the steps in your house?" "No." I said, did you drive here?" She said, "Yes, but very often I take the bus, and I live on a hill, and I have to walk up. Sometimes I run up when the bus is coming, and I have no problem." I said, "When do you have this cough problem?" She said, "It's when I'm in bed." So no activity. She said, "Sometimes I fall asleep on the sofa watching television, and I don't have a cough, but when I'm in bed, I have a cough." I said, "Well, it's your bed. So you have to be a good detective." I said, "What do you wash your pillowcases in?" "Well, commercial fabric softeners, anti-cling sheets, commercial detergent." Well, we wanted her to get her shoulder worked on, and my therapist didn't have time until the afternoon. So here's what she did. She bought our detergent. She drove home. She did her pillowcases in our detergent, and she laid down for an hour for a nap, and she had no cough anymore. Then she came back this afternoon. She said, "You solved my problem already." And then we worked on her shoulder and fixed that. And they were saying it was a heart problem. It was the detergent, fabric softeners, anti-cling sheets. So that could be a factor. You can make an appointment with me. I'll test you for allergies. I have treatments that can correct it. Meanwhile, we do have the N-acetylcysteine, the Aramax, the fenugreek, the allergy. These products can help manage it. The drugs they give people really create new problems. Now, I'm running into the next person's time. So what I'm going to do is I'm going to go over there, and if you have questions, I'll answer the questions. Keep in mind, our phone number at the office is 412-922-WELL or 412-922-9355. The Weiner Wellness Center at 2419 Baldwick Road. Yes, we do see patients, not just give free lectures. And so if you have any health challenges and you want a second opinion, maybe you're loaded up on drugs. I'm 68 and a half. I take no medications. I'm not telling you to get off your medications, but medications are the third leading cause of death in the United States. And we're consuming 75% of the world's drugs, even though we're only 4% of the world's population. So treating symptoms with drugs is not necessarily the answer. We look forward to seeing you again. God bless you and have a nice day.